Halo, Assalamualaikum warahmatullahi wabarakatuh. Good evening, everyone, and welcome to my class again. Today, we talk about types of consent. Consent is a permission to render care. Typically, consent is required from every conscious adult before care can be started. A person receiving care must give a permission or consent for treatment. An adult who is conscious, rational, and capable of making informed decisions has a legal right to refuse care, even though this person may be ill or injured. A foundation of consent is decision-making capacity. Decision-making capacity is the ability of the patient to understand the information you are providing, coupled with the ability to process that information to make an informed choice regarding medical care. It is important to keep in mind that the law allows the patient to make choices that may be seen medically unsound and that might endanger the patient's life. The right of the patient make decision concern his or her health is known as a patient autonomy. The first type of consent is express consent. The patient acknowledges he or she wants you to provide care or transport. Express consent or actual consent is the type of consent given when the patient specifically acknowledges that he or she wants you to provide a care or transport. Express consent may be verbal or non-verbal. For example, if you ask the patient if you can check his or her blood pressure and the patient says yes, that is a verbal consent. If the patient nods yes or extend an arm to you, the patient is expressing consent non-verbally. So to be valid, the consent the patient provide must be informed consent, which means that you explain the nature of the treatment being offered, along with the potential risks, benefit, and alternative to treatment, as well as a potential consequences of refusing treatment. Implied consent. When a person is unconscious or otherwise incapable of making rational, informed decision about care and unable to give consent, the law assumes that the patient would consent to care and transport to the medical facility if he or she were able to do so. So when a serious threat to life exists and the patient is unconscious or otherwise unable to give consent, the law assumes that the patient would give consent to care and transport to the hospital. And of course, should not be used unless there is a threat to life or limb. Principle of implied consent is known as the emergency doctrine. And you also have to try to get consent from the spouse or relative. Involuntary consent. Assisting a patient who are mentally sick, developmentally delayed, or who are in behavioral or psychological crisis is complicated. An adult patient who is mentally incompetent is not able to give informed consent. From a legal perspective, the situation is similar to those involving minors. Consent for emergency care should be obtained from someone who is legally responsible for the patient, such as a guardian or conservator. In many cases, however, such permission will not be readily obtainable. Minors and consent. Because a minor might not have the wisdom, maturity, or judgment to give consent, the law requires that the parent or legal guardian, when available, give consent for treatment or transport. In some states, the minor can give consent. For example, emancipated minor, married, armed services, and parent. And also teacher and school official may be act in place of the parent. If true emergency exists and no consent is available, so you have to treat the patient. So it is called consent is implied. If minor is injury and require medical treatment in school or camp setting, teachers and school officials may be act in loco parentis, which means in the position or place of the parent and can legally give consent for the patient of the minor if a parent or guardian is not available. You should still attempt to obtain a consent from a parent or legal guardian whenever possible. However, if a true emergency exists and the parent or legal guardian is not available, the consent to treat the minor is implied, just as with an adult. You must never withhold life-saving care for a minor because a person authorized to provide consent is not available.